Welcome to Chai Pe Charcha with Dr Murali Bharadwaz. I hope the last 2 days you all have enjoyed a wonderful class with Dr. Gopati Srinivas, who is a very good pediatrician. Once upon a time, our student, just like you, and a very good passionate teacher who adds a lot of practical uh, clinical vignettes and situations while he's teaching. Very good. Yes. So we are with the last 15 years of NEET PG question papers subject wise. In that we had been discussing neurology. So let us continue our discussion in neurology. Shika Munka, Brahmatir, Chaturvedi, Mithun, Vijay, and many more were all online. TIA, what is the definition? Transient ischemic attack. Any focal neurological deficit which is less than 24 hours of duration, can close the door, is basically called the TIA. But it was a very old definition. Nowadays, the modern definition is TIAs are all less than 1 hour. If the TIA is lasting more than 1 hour, then there is a less than 15% of chance of resolution within 24 hours. So it's very unlikely. Only 15% of TIAs that persisted beyond 1 hour will be able to resolve within 24 hours. This reason that 24 hours is little shaky definition. A patient presents with subarachnoid hemorrhage. The non-contrast CT typically shows the blood in the fourth ventricle, and the bleeding is most likely to occur from the aneurysm of which important vessel? This is what many times it was repeated in the All India MD entrance exam. Pica, the posterior inferior cerebellar artery occlusion versus anterior communicating artery. Actually, answer should be D. Anterior communicating artery, but okay, there is a blood in the fourth ventricle. So that is the reason it is most likely to be the pica which has undergone the rupture, a saccular aneurysm, a berry aneurysm has undergone a rupture and led to the development of the subarachnoid hemorrhage is what you need to remember. Yes. Yes. Why the PPT has less screen ratio? Okay. Students are very intelligent. Very sensitively they will catch up the changes. Huh? That's good. That's good. There is one more change which is there below, which is called super chat. Super chat is a lot of gamers when they host a free game on the YouTube. When about 1,000 audience are there, somebody's chat need to be a little longer on the top. So they basically support the YouTuber by paying to the presenter. That's called super chat option. So YouTube has congratulated us that a lot of medical education is all going on every day. So you can give an opportunity for your students to donate to support the program by clicking on the super chat and making the pay, but it's okay. So that is a super chat feature. On the chat you have super chat. If you happen to click on that, it will say how long your message should be on the top, right? Now, what is a lacunar stroke? Typically, a male with a hypertension who has atherosclerosis is the classical scenario. where the lenticulostriate vessels undergo a lipohyalinosis and that lead to what is called as a lacunar stroke. Good. Commandant is asking how to donate. Just click on the super chat. It will ask, it will enable you to make a payment to the credit card. So it's okay. Yes, but there are some other teachers, when they deliver the lecture, you can always support the program by 40 rupees or 100 rupees of donation. Yeah. So if you look at the classical cases of lacunar stroke, age more than 63, male gender, hypertension, diabetes, previous history of smoking, coronary artery disease. These are all the ones which are considered to be the risk factors for the development of the lacunar stroke is what you need to remember. What's the most common territory where there is a development of cerebral infarction was the question of the NEET PG 2014 and 2015. 2 times asked. So obviously, you know, it is the middle cerebral artery which is the most common site. Very good. Pranay and Aruna and many more. Please keep punching your answers parallelly so that it will be like a quick revision, right? Now, if we look at the various territories, already you know, anterocerebral artery territory stroke will lead to contralateral lower limb monoparesis. Middle cerebral artery, hemiplegia. Brainstem stroke, there will be contralateral hemiplegia, ipsilateral cranial nerve nuclei, cranial nerve paralysis. That's called crossed hemiplegia. Is the nature of the brainstem stroke as what we have discussed in the last class. Hemiplegia is most often caused by thrombosis of what? It is the middle cerebral artery occlusion. Every time examiner want to know from you that it's the MCQs stroke. If there is a hemiplegia with homonymous hemianopia with the gaze to the same side as the lesion, then where is the occlusion is a very, very interesting question. We already discussed this point very diligently in the last session, but for the brevity of clarity, I'll try to review it. Can you get me the board? So, whenever there is any stroke, classically, you have a cerebral cortex. Here the bleeding can occur. This is a midline. You have the right and left cerebral hemisphere. Then typically in the brainstem you are having the midbrain, then pons, and then medulla. Then you have cranial nerve nuclei. What's happening? Oh, you try to make it smaller. Right, very good. Okay? Yeah. Okay. Yeah. Come in. Okay. It's fine. Right. Hope it is clear, right? Now, if there is any hemorrhage directly in the cerebral cortex, then what do you get? You get a contralateral, that is left-sided hemiplegia. Then suppose if there is any lesion which is happening in say the midbrain, then you get the third cranial paralysis, and that is on the right side, and on the left side you are getting the hemiplegia. Then 5th, 6th, 7th, suppose pons is having a hemorrhage. Then 5th, 6th and 6th is also supplying extraocular muscles. that get affected on the right side ipsilaterally, and the contralateral side you are getting hemiplegia. That's called crossed hemiplegia. Now, whenever the bleed is there only in the hemisphere, then the eyes will show a conjugate deviation and they look towards the side where the bleed is there. If the bleed is located in the cerebral hemisphere. But if the bleed is located in midbrain or in the pons, that is the brainstem, then there is a conjugate gaze of the eyes, but it will be towards the contralateral side the patient will be looking. If there is a right side brainstem bleed, then left side will be looking. Conjugate gaze is what you have to ultimately remember.